Hey guys, welcome back for another installment of Neuro Life Skills. I'm Dr. Longyear with Dr. Federley on the other side there. And today we have a special guest. Our guests are always special, right? But we have Dr. Leslie Parish, soon to be Dr. Leslie Federley, who is a doctor of physical therapy. And this is a fun one because obviously they're a couple, so I'm going to be doing hand checks every once in a while. But it's also really cool because she's a physical therapist that specializes with neurodevelopmental disorders with kids. She works with a lot of kids that have a lot of issues, and I thought this was a good one because you've been seeing a lot of stuff all over social media right now about the CDC changing their guidelines and what does it mean and all that kind of stuff. And she's in that world, so I thought this was really cool. I also, to address the elephant in the room, we're supposed to hate each other, right? Physical therapists and chiropractors aren't supposed to get along, or something. The Montagues and the Capulets, or something somewhere in there, right? So I thought it was really cool to bring her on and just talk a little bit about all of that, right? The fact that I think we're maybe more in line with our philosophies than we are apart, and I don't know that the divide is necessarily supposed to be there or something that we just kind of have created over time. And also to really address this thing with the CDC guidelines, because a lot of people are freaking out. There's a lot of people like, well, my kid might not be able to get care now. Is there something not wrong with him? You guys have been telling me that he's supposed to crawl at this time, and now they say this. And I think we just kind of need to take a step, take a breath, and think about it, right? Think logically about it. If we followed these as we go, it's Neuro Life Skills, right? It's what skills do we need to develop and have a good, healthy life, whether it's compassion or whether it's having a purpose, like Dr. LaMarche talked about in the beginning, or sleep as a weapon and a skill with Dr. Porter. And now kind of understanding what we're looking for with, neurodevelopment and those kind of things. The CDC has changed guidelines over the years, right? Normal blood pressure used to be 110/70. Normal resting heart rate is 60 to 100, yet anything over 80 shows increased risk of cardiovascular. The guidelines by the CDC are just that, they're guidelines. They're not meant to determine health and wellness and all of those things, but I think that's where we live, right? That's where you need to have somebody in your corner and fighting for you, and as a resource. And Dr. Leslie can be a resource, we can be a resource, and in understanding what it really means to be healthy as opposed to fitting inside of a box. So the fact that they changed the guidelines, they just changed the guidelines. We still look for very similar and the same things that we've always looked for to know whether or not we have good neurological health. So I guess we'll jump right in there with the guidelines. What are your thoughts on where we're at and what it means, and should we all be jumping off of buildings, or what's going on?
So the main thing to start with is just that they changed things from when 50% of kids attain a skill to when 75% of kids attain a skill. So that's why we saw things like sitting moved back from 6 to 9 months, crawling disappeared altogether, walking moved from 12 to 18 months. Those are the ones I'm most familiar with because that's what I look for as growth motor milestones. But I know they also moved some stuff with speech and OT concerns as well. And I do understand where they're coming from, because if you look at the statistical bell curve, technically 75% is the cutoff for normal. But I know my concern, some of the concerns that the parents have been voicing to me is like what you're talking about. We've made this big push, especially in pediatric physical therapy. We made such a big push for early intervention. Because kids are so resilient, and if we can get them early, we a lot of times can see bigger changes with them. So I know that's been kind of the concern, is that are we going to be delayed in being able to see them? But at the same time, once I get a kid in to see me, I have a standardized test that I'm going to do based on their age. And what it says might be different than the guidelines, or I might be able to pick up on a spot that they're behind because I'm looking at their whole development. So if I can just get my hands on them, a lot of times I can find the concerns that I know parents are seeing, and find a way to get them the care that they need to get. Especially just thinking about with the guidelines changing backwards, well, if I'm walking 6 months later, I'm not going to be jumping at the age of 2 like I need to. I'm not going to be managing the stairs at the age of 2 like I need to. So am I just going to be behind for years now because I got behind here. And I know for y'all and us, I feel like we would both just rather be on the ground floor.
Exactly, yeah. Getting started, and you said something I think that's really important. And I think a lot of people don't get this. And I know, sometimes things get blown out of proportion on social media and kind of mob mentality. You've seen a lot of people really vilifying the CDC, saying they just don't care about development, or they're normalizing dysfunction, and they are. But we need to understand, and you said something really important there of, we changed the milestone from what 50% of kids can do to what 75% of kids can do, right? So that's exactly what the guidelines are, is they're taking what normative values are, not necessarily healthy. And that, to me, that's a big thing, right? It's not necessarily, we shouldn't be vilifying the CDC, but we just need to focus more. It's the same thing when you when you raise blood pressure normative values, because 50% of the people have that. But when you look at that, if you're normal, most of the population has cardiovascular disease. I don't necessarily want to be normal. So even in our office, if you come in and you're a female and you're 120/80, that's kind of hypertension in our world. So how do you get that across to parents, or how are we going to really, when parents come in and say, well, my kid's not walking yet, but that's normal, right?
Yeah, I mean, and that does happen sometimes. I think for the most part, people have their parental gut that tells them that something's wrong. And also, I know at least in my clinic and my experience, we have developed a pretty good relationship with the pediatricians near us, where if they feel like they are seeing any kind of problem, they would rather just let us look at it rather than taking a wait and see approach. But I feel like at the end of the day, you just kind of have to follow your gut. And when it comes to walking specifically, a lot of times the conversation that I have is like, it might be okay that they're not walking now because they're small, but they're not going to be this small forever. So let's get them up on their own feet.
Yeah, you don't want to have to be carrying the big kid around.
Right.
It's all right when they're small.
Yeah.
But there's just a lot in there with that too. Is hitting those milestones or not hitting those milestones. You said it's in their gut, right? And we, Dr. Federley and I always joke about how the mom is really the first functional neurologist. You guys know best, moms and dads. You guys see your kid on a daily basis. You know when something's just not right. We get a lot of kids in, and mom's like, I've been to a bunch of places, and they keep telling me he's fine, or he's normal, or he's in this percentile, but I just know something's not right. And it wasn't too long ago that they couldn't diagnose things like autism or spectrum diseases until 6-7 years old. Well, if you look at the research, you can actually determine neurodevelopmental delay with two really simple tests, pupil area fatigue and pull to sit. There's huge correlations in that at 6 months. And like you said, if we can get them on the ground floor at 6 months, we can make changes.
Yeah.
I've often said, if we all do our job right when we're working with kids, they'll never know we did anything at all. Because we get to catch them early enough that we kind of get them on the right track, and we catch them up. And when it gets to time to actually be able to diagnose them with something that's detrimental or deficit, they don't test anymore for that.
Right.
So I think it's important that we, that, like you said, they do follow their gut, that the parents, if something's wrong with Junior, get them in.
Yeah.
Have her take a look. So what are some of the tests that you do with kids? Because I love how you said that, like it might not be the guidelines. I have my test, I'm going to look at their overall development.
Yeah.
What are some of the other things that you might look at?
So the most common tests that I do are 2 different standardized tests depending on a child's age. So from 0 to 6, I'm going to do a test called the P-Body, or the PDMS-2 for short. And then for kids over the age of 4, I can do a test called the VOT2. It's funny that you mentioned head lag and pull to sit, because that's actually one of the biggest sections of the baby portion of the P-Body. It's just looking at can they control their head when they're coming up to sitting. But in the P-Body, I'm going to look at their reflexes, I'm going to look at how they're balancing, how they're able to hold themselves up, and I'm going to look at how they're moving. And then in the VOT, since they're older, it's looking a little bit more at their coordination, like how well they're standing on one foot, how strong they are. Can they do the kinds of things that they would need to do on like the presidential physical fitness test, the kinds of things that help them.
Baby pull-ups.
Exactly, right. The kinds of things that help them keep up with their peers. Because I think that's what you notice as kids get older, and that's the more of the concern I hear when I'm talking to a parent of a child who's 5, 9, whatever. They're talking to me about like, oh, they can't keep up with their friends on the playground. And so that's the concern that I see when they're a little bit older. So my older test focuses a little bit more on things like that would help them keep up in PE.
Okay. So keeping the kids fit. So they got to be able to do 12 pull-ups. I remember when I was back in school. Yeah, I think I would fail some of the presidential testing now, but and I think a lot of people do. And you know, that normative, and I love how you said that, keeping up with their peers, and that's really why the CDC guidelines change. Is that it's always a moving target because they're always looking at what the gross number of people are doing. You know, wherever you sit on the side of the COVID thing or whatever, they're getting ready for a big decrease in developmental milestones, or a big decrease in what kids are able to do. And again, it doesn't have as much to do with COVID or vaccines or any of that. It has to do with the fact that people were isolated. And isolation drives down development both in pediatric population as well as adults as well as older people. There's a ton of research out there that says, you know, if you want to decrease your likelihood of having Alzheimer's, you need to have 5 close friends. That social interaction, or lack thereof, changes our development. And I think that's why you're seeing a change in some of this with kids. And you see it coming out of Stanford, did some research recently about what they expect kids to be able to do and how they interact in their social environment, how well they keep up with their peers, right? Because they're not being exposed to their peers in the same way. If you look at online school, they're not being exposed to other kids their age in the same way that they were in the past. So I think that's why we're seeing a bit of a shift and a bit of a change, and we need to change our focus in the way that we look at things as a result of that. So
yeah, it is actually interesting that you mentioned that though, because from a gross motor standpoint, there is actually some research that has talked about how babies have attained their milestones faster in the last 2 years
through all of this,
because they're with their parents more. So then who's a better motivator to move than mama? So that's another thing that I actually think is interesting about the fact that they changed it now, is because because I primarily right now see babies with torticollis based on the location that I'm in, which is when they're born with their little head tilted. And a lot of my babies are on track, if not ahead.
Really?
And some of that's because I get to start seeing, you know, the youngest patient I've been able to see in the last year was 3 weeks old. So I'm able to get them really early to try to address the musculoskeletal issue they have. And obviously I'm working on their milestones while I'm doing that. But yeah, a lot of my babies are able to stay on track because they're able to be with their parents so much more in the last year.
Yeah, they've had a family member at home kind of pushing them and making them do some of that stuff. So
yeah,
that's
I think
cool to hear the other side of it too, because what we're seeing from an emotional or developmental disorder thing on that side, but I never thought about that kind of the gross motor side of that.
Yeah, and even on top of that, you know, something that from time to time we'll hear with parents is being ahead of development. So skipping a couple steps. So my baby's walking, oh my gosh, they're only 1 month old. You're like, whoa, easy. But really that stepwise progression of knowing, you know, although parents can be a great motivator and a great emotional support, having a professional eye on it, like Dr. Leslie or having a chiropractor work, we're really all looking at the same thing, is that proper tone develops at the right times. Yeah. So really that we're able to work through this progression. Again, it's really this cool yin and yang of, you see something like poor head lag. Well, how do we develop that? Well, we need to be able to have tummy time and lift your head and have good muscular tone to lift your head. And then comes the rolling, and then comes the crawling, and then comes the standing. So it's almost like, and actually it's really funny, Dr. Longer and I, we've seen some really high level athletes in here, professional athletes, where we're getting them on the ground and we're reteaching them to crawl. So they may or may not have missed, skipped, or lost some steps along the way to then stack more dysfunction on top. Yeah. So when we're looking at these pieces, you kind of have this window where we can really appropriately establish good function to then build more function on top of it. Otherwise, you really just have this scaffolding of dysfunction that you're just stacking it all on top of. Right. So it gets to be fun hearing you talk about it and saying that not only are people kind of more developmentally sound, but you're seeing these pieces where you can actually do something about it and improve their tone, as well as just keeping an eye on it and tracking it as well.
Yeah, well, since you mentioned dropping stuff, let's talk about the fact that they did drop crawling from milestones, which I know is something that a lot of people have been talking to me about. I'm not a big fan of that, of the fact that we just dropped crawling entirely. That is something I want to see kids doing in like a 8 to 10 month kind of range, because it's really important it's the first time that we see us doing a cross pattern where we're moving right leg, left arm, and vice versa, which is what we do when we walk. Also, weight bearing is one of the best ways to build bone density, so we need to be on our hands and knees for a little bit. And then obviously that's a really important time for us to build core strength and to help us build those patterns. But maybe since you said you make pro athletes do it, if you want to talk a little bit about why crawling is important in your opinion.
So sometimes what we're going to do is we may reteach this pattern. We may teach with something like a metronome and have people coordinate that flexion of one side, upper body, flexion of opposite side, lower body, extension as well. So when we see that from a reflexive standpoint, there are these patterns that exist within development so that we can have a good cadence, a smooth rhythm. So what we're looking for is to see if, again, we can stack something that's a great framework of movement in general and make sure these patterns match. Otherwise, what we may see is some dysfunction in movement, or even with walking. You may see some changes in gait. I would say gait is probably one of the most dynamic tests that you can use in terms of just watching somebody walk. And if we trace it all the way back, and it's not uncommon for us to ask that too, is has your baby developed a little bit differently? And parents are like, no. Oh, did they crawl at the normal milestones as to what we were more familiar with in the past? And say, no, they did great. And then come to find out, like, well, they did kind of do this flat tire scoot, and they were just kind of like dragging a leg along. And it's not a perfect pattern. The brain likes efficient patterns, and with that, we can develop more efficient patterns on top of that. And when we even look at things like neurodegeneration way down the line, we also see patterns break down. So anywhere along the spectrum, regardless of age, really, we're looking for efficient patterns. And again, when we find one deficient pattern, we might find things that also kind of stack on top of it or even mix in to make the brain kind of work on overload. I mean, one of the funny analogies that we make in here is the brain does a lot of things that we know of. The brain also does a lot of things we have no idea that we even calculate. Something as simple as the distance between me and you and this camera here and these lights and sounds, and even gravity. I mean, those are things that we should not really detect all that much. But if your muscles or your tone is resisting gravity in a certain way, you might present in a way that has a ton of dysfunction and runs you into the ground earlier than what it should. In terms of brain economics, we should have a nice sharing load of where resources go. If it's running something on overdrive, it's like giving Jim working at the office everybody's workload and expecting it to go smoothly. Jim's probably going to quit. So with that being said, we don't want to overload Jim. You want to share the workload with everybody that's supposed to, between the frontal lobe, the cerebellum, parts in the brain that set things automatically, but also consciously well, so we can all kind of share the workload together. And even in terms of development, it's really kind of fun to see, and that cracks me up. It blows my mind, and it makes me think of the brain as like an alien organ, the more that we really talk about it. Something as simple as, getting on your feet and moving. And we talk about just what seems to make sense. When the brain starts getting more graviceptive information through all the joints, that's around the time when kids start really articulating a little bit better. So all of that information feeding the frontal lobe feeds an area in the frontal lobe where it can push development to the point where we start to see some things really skyrocket. And when people talk about babies' brains looking like sponges or absorbing so much, it just cracks me up because I'm like, oh my gosh, it's so true. Yeah. Really, when we talk about it. And even developmentally, we start from more of a right brain where we can sense and see and feel, and then we switch over into more analytical. Often why you see babies, again, when they start getting on their feet and moving and navigating and exploring, their brains are just exploding with information to where they can start integrating all this stuff. But again, traces back to way back when we developed these first patterns and this good baseline and a good scaffolding to stack function on top of, which again, it's fun to see that, and it's also kind of fun to see it change so quickly in babies' brains as well. We've got a young girl in here where that's one of the things we're working on is crawling. But as soon as we get things like handling gravity appropriately and also getting these patterns moving a little bit, her tone starts to improve. She starts to kind of wake up a little bit more, and we get to see that. And that's a lot of fun when you see babies kind of perk up a little bit and they're actually hitting their milestones a little bit cleaner.
Yeah.
Babies are the most fun to work with. They don't yell. Well, they do yell at you constantly, just not in different types of ways. But I love, you guys said a lot of really great things in there. Whether especially putting function on top of dysfunction, right? Going back to the professional athletes, that's where we've had to retrain some things. When we work with concussion, if they've skipped some of the developmental milestones, like you hear parents say, "Oh yeah, my kid walked at 10 months," push them down. Because they need to develop more cross cord. Otherwise, they're going to end up in here when they have their concussion. We often, Dr. Federle and I often say that concussions don't always make new injuries. They just bring about some old dysfunctional patterns. So if we've had an athlete that had a really bad concussion that wasn't getting better, and we have to reteach them to crawl or roll over, it's usually because they skipped that milestone a little bit. And we actually have to go back and kind of rewire that to build function on top of function, as opposed to function on top of dysfunction. So going back and almost rewinding or resetting some of those patterns that Dr. Don talked about because your body and your brain is really a pattern generator. You don't walk down the road going left foot, right foot, breathe, left foot, right foot, breathe, left. Those are all things that are done unconsciously, because you've done them in a stepwise form and in a developmental way that was appropriate, right? So the kid that's walking at 10 months is probably skipping some things that he's going to regret later on, or she's going to regret later on. So it's important that we pay attention to those and really come back to that. Because otherwise, when you have a little bit of a head hit, you might end up in here relearning those things that you skipped over at 10, 11, 12 months that you were star pupil on, but maybe not necessarily developing in the right way. And again, I love the right to left. Babies develop that ability to lift their head up in posture, which is more right brain, developing that cervical curve. That's why we look at that so closely, because it tells us the health of the right brain. If you start to lose your cervical curve, you're losing the health and the function of your prefrontal cortex. Flexors are winning. You're back to this kind of thing as opposed to that good tone. So I know as chiropractors, we're used to looking at posture. We're used to looking at flexor tone, and too much flexor tone means not enough brain tone. But kind of bringing it back to, if the CDC guidelines aren't good enough to follow, what are some things that moms and dads at home with their kids can look for? Throwing out the CDC being our guidelines for health and wellness, they're guidelines for what is average. And average is neurodevelopmental disease by the age of 60, average is heart disease, average is cancer right now. So we don't want to be average. How can parents look for their kid to be better than average?
I mean, to be honest, I guess my thing is I did prefer it when it was based on when 50% of people were doing something.
Okay.
So that's kind of where I'm gonna stay, and I know that's where like my standardized test still stays. I want a kid to be, 50%, 10 out of 20, like that's the sweet spot of where I want them to be. So I know the big things that I look for, if we're just gonna go by like quarters of 0 to 12 months, by 3 months I want to see them doing a caudal weight shift. So when they're on their stomach, I want them to be able to get up into prone on elbows and shift their weight back towards their butt.
So like a baby plank.
Oh, well, their legs are still on the ground. I do make a lot of babies do planks,
So
so they're not a fan.
You're making babies do planks?
Yeah.
And burpees probably.
No, burpees we'll save for later, but I do make my babies do a lot of planks. But yeah, because them being able to bear weight through their arms is an important factor for them being able to roll later, as well as just generally starting to develop the first little bit of anti-gravity muscle. At 6 months, I want to see them rolling back to belly back over both shoulders, and I want them to be sitting up. I know they move sitting back to 9 months, and I do have some kids who are a little bit later on their sitting, because we do actually, closer to the 6-7 month mark, we start to develop our protective reactions, our reflexes of when I fall this way, I need to put my arm down or something bad's going to happen. And so a lot of times that's what takes my babies a little bit longer, is when they're actually trying to develop the pattern of being like, I've got to put my arm down when I'm going this way. So that's what I want to see at 6 months. 9 months, I want to see crawling. 12 months, I want to see walking.
Okay. So you hear that, moms and dads. If you see those things at 3, 6, and 9, and 3, 6, 9, and 12, some milestones to watch for. What if when is it time to panic? Or is there anything that they can kind of do to see if it's just a little thing?
Yeah. I mean, I try to get people to never panic. That's my general goal, but I know, like, it never hurts to ask your doctor. Like I was saying earlier, I think most of our pediatricians, at least in my area, will, they say it doesn't hurt to get an evaluation. So a lot of times they will just send them over to us, OT or speech, because we can check, and if we think there's a concern, we'll start, and if we think there's not, we won't. So it never hurts to ask. And then, I mean, you can also check, I think, because one of the big differences actually between PTs and chiropractors is direct access, that people just walk straight in to see you without anything. And that's something PTs have been fighting pretty hard for. So you can also always check to see if your state is, because I want to say like 27, most states have some form of direct access where you could just walk into a PT office and say, I want it to be evaluated. So that's another thing you can always look into if you feel like you're not being heard out by your pediatrician, is seeing if it's something that you're able to just bring them straight in. Because if I see a kid and I think they're on track, or, you know, I can't get them to qualify, I can still give mom, here's some stuff to be doing to address the concerns that you have. It's very easy for me to just give out activities. And, you know, people ask me for that all the time. I'm sure people ask y'all for stuff to do as soon as day one of school, people were probably like, how do I fix this? Please pop this. And you're just like, whoa, I don't know how to do that yet. But, you know, like, I give people activities and stuff to do all the time to address their concerns. And another thing, like, I make it a goal for my parents who are in treatment, once you've found some activities that you can do to address the concern you're having, I never want to overwhelm them, so I make it my goal for them is that I want them to do like a purposeful activity directed at their concern for 20 minutes a day. Like, it's not something that has to take up your whole day. You don't have to spend hours and hours trying to get your kid to sit up, but if you just find some really good activities and you spend 20 goal-directed minutes on it every day, I feel like you can see some pretty big changes with just that amount of time.
Okay, I love that. Yeah, 20 minutes. So it's not like my mom smacking me in the back of the head all the time, telling me to sit up straight. So she didn't need to do that all day, just for 20 minutes.
Yeah, exactly.
No, but focusing, I love that, kind of focusing on it and driving it. It still blows my mind that you guys don't have direct access to. You guys are doctors of physical therapy. It's DPT now, right? It's not, you know, the old days when I was going to school, way back when. It was physical therapy. It was a master's degree program essentially, but you guys have been doctors of physical therapy for long enough. I think that, the direct access, and I think, maybe that's where the bridge is built too. Mm-hmm. We don't do the same things. I think we fit together philosophically very well. Yeah. But chiros and PTs referring back and forth, I think is the future, or in the best interest of our patients, right? Mm-hmm. A lot of people, if I were to tell some of my friends that we were going to have a PT on our podcast, they'd be like, wait a minute, why?
People asked that when I said I was dating a chiropractor.
And it shouldn't be that way, right? We're way more philosophically in line, I think, than we are different, and, building that bridge and understanding that. So I really appreciate you coming on and extending that olive branch to build the bridge, knock down the wall, and kind of go that route. And also the great information, especially right now I kind of feel like a lot of people are up in arms about the CDC thing. So I appreciate you letting us know that because I don't think a lot of people that are posting it necessarily understand that it's based off of the 50-75 rule, right? So it is going to change, and we laid it back, but again, those are guidelines. Remember, it's not necessarily health and wellness, it's pathological disease, and we never really want to be average, because the average person is not doing well. So take it with a grain of salt. Understand that we still have to be the education out there for the public. We still have to be the gold standard. And we just need to educate people better and make sure it's on the right thing. So I appreciate you for coming, and thank you guys for watching. We'll have another one of these again in about a month or so. And until then, keep up with your Neuro Life Skills.